Cervical myelopathy, as I said, is a bit more concerning than cervical radiculopathy, as there's compression of the spinal cord, and if it's left untreated, that can cause irreversible damage to the spinal cord and a potential loss of function. That is why I have a lower threshold to consider surgical intervention for cervical myelopathy than I do over cervical radiculopathy. Hi, I'm Mr. Kiran Divani, and I'm a Consultant Orthopaedic Spinal Surgeon based in North London. Today I'd like to talk about two very important conditions of the cervical spine, i.e. the neck, and they are cervical myelopathy and cervical radiculopathy. They're very common and important conditions that I routinely see in my outpatient department. So by talking about these conditions, I'd hope to help you have a better understanding as to what they are, the different causes for these conditions, and the way in which we can go on to potentially treat these conditions. So what are they? Cervical myelopathy is essentially a compression of the spinal cord in the neck, and that can happen by various causes. It can happen at various levels, and it can happen to different extent and severity. So typically when you get compression of the spinal cord in the neck, patient may present with very specific symptoms. They may find that they have got a weakness or a clumsiness in their hands. They may find that doing fine activities that require a lot of dexterity difficult, such as buttoning up shirts, using a knife and fork, using keys. Handwriting might go a bit messy. They may find that they're dropping items a bit more as well. They also may find that their legs have gone a bit weak, or they may feel that they're off balance and end up having recurrent falls. A late sign and symptom is when the bladder and bowel starts to get involved as well, and there may be episodes of incontinence. Cervical radiculopathy, on the other hand, is slightly different in that it's a compression of an individual nerve root as it exits the spinal cord, and that can cause quite a sharp, unpleasant neuropathic pain that goes down the arm and into the hand. It's essentially the sciatica equivalent of the upper limbs. Patients may find that they're experiencing sensations such as pins and needles, tingling, electric shocks, and occasionally it may be associated with a numbness and a weakness in a specific part of the hand, and that part very much does depend on the nerve that's being compressed. So cervical radiculopathy and cervical myelopathy, as I said, are two common things I see in my outpatient department, and I can typically find out which one you have from taking a thorough history, by examining you, and by also doing some investigations. An MRI scan is a very useful tool to further evaluate the condition of the cervical spine. It allows me to see various anatomical landmarks such as the intervertebral discs and also the facet joints. It allows me to see how compressed the spinal cord and the nerves are. It also allows me to see what level is involved, and that helps me plan if any further treatment such as surgery is required. In terms of treatment, cervical radiculopathy can be managed conservatively in the first instance, and that may be by avoiding aggravating factors, modifying activities, taking simple pain relief, or even neuropathic agents that can help block some pain pathways and alleviate pain that way. Should patients fail to respond to these conservative measures, there are second-line treatments available, such as nerve root injections, and those can be done under CT guidance or X-ray guidance in the operating theatre, and that essentially involves injecting around the nerve with a local anaesthetic and a steroid. Sometimes that in itself can take the inflammation off the nerve and help improve a lot of the symptoms. If patients fail to respond to those conservative treatments, surgery may be required. The nature of the operation very much, as I said, depends on where the compression is coming from and the extent of the compression and over how many levels. If the compression of the nerve is because of a disc prolapse from the front of the neck, then you may benefit from an operation through the front of the neck known as an anterior cervical discectomy and fusion, or an anterior cervical discectomy and disc replacement. That essentially involves me going into the front of your neck, moving very important blood vessels and nerves to one side, your food pipe and your windpipe to one side, so I can get to the spine, remove the disc, and either fuse the bone together with a metal cage. Alternatively, I can insert a disc replacement if that is an appropriate option. Sometimes there is bony compression from the back of the neck, and that requires me to approach the neck posteriorly, and I may need to remove a bony window to create more space for the nerves that way. Cervical myelopathy, as I said, is a bit more concerning than cervical radiculopathy, as there's compression of the spinal cord, and if it's left untreated, that can cause irreversible damage to the spinal cord and a potential loss of function. That is why I have a lower threshold to consider surgical intervention for cervical myelopathy than I do over cervical radiculopathy. To find out more about these conditions and to find out more about me, please visit kdspines.com.